Menstrual health and hygiene is very important and essential for the well-being and empowerment of women and adolescent girls. On any given day, more than 300 million women are menstruating. In total, 500 million women do not have access to proper menstrual hygiene products and facilities for menstrual hygiene management. Women around the world are also stigmatized and excluded just because they are menstruating, which is a normal bodily function. So it is very imperative to break the taboos and end the stigma around menstruation. To effectively manage their menstruation, girls and women need access to water, sanitation and hygiene facilities, affordable and appropriate menstrual management products, access to good practices, and also a supportive environment in which they can manage their menstruation without any embarrassment or stigma. According to WHO and UNICEF, a joint program known as Menstrual Hygiene Management was launched in 2012, which defines it as when women and girls are using clean menstrual products such as sanitary napkins and tampons, etc., to collect their menstrual blood or absorb the menstrual blood, and they have access to, it can be changed in privacy as and when required. They have access to soap and water to wash the body as and when required, and they also have proper facilities to dispose the menstrual products according to the need. They should understand the basic facts linked to the menstrual cycle, and also that how can they manage it without any with dignity and without any fear or embarrassment. The priority areas are education and health. Schools that incorporate female-friendly facilities and include the information on menstrual hygiene in the curriculum for both boys and girls can contribute to ending the stigma around menstruation and also come up with better education and health outcomes. The next is health, where poor menstrual hygiene can lead to reproductive and urinary tract infections, which can further lead to fertility complications and also birth complications. Washing of hands after changing the menstrual products is very, very important to prevent very serious infections like hepatitis B, STDs, thrush and bacterial vaginosis. National Health Mission. The Ministry of Health and Family Welfare has introduced a scheme on menstrual health promotion for adolescent girls of the age group of 10 to 19 years in the rural areas. The major objectives are to increase the awareness among the adolescent girls about menstrual hygiene, to increase the access to high quality menstrual hygiene products, and also to encourage and ensure safe disposal of the used menstrual hygiene products. May 28 is marked as the Menstrual Hygiene Day, and the basic idea and the aim is to end the taboos around menstruation and make it a normal life function by 2030. Menstrual hygiene for new moms. The first few weeks with a new baby are very demanding emotionally and physically for a new mother. In this session, I shall review the key information to be communicated to the new mothers and also to their partners and their families. The importance of diet, well-balanced diet consisting of milk, nuts, oils, veggies, cereals and fruits, and plenty of clean and safe drinking water should be emphasized. The new mother should take rest and avoid hard physical labor. The normal vaginal bleeding just after childbirth may last for 5 to 7 days, which is the amount and the duration may be variable in different individuals, but it is usually heavier than the usual normal period. The vaginal discharge that follows, which is also called the lochia, may last for the next 3 to 6 weeks. Initially it may be heavy, but gradually it wanes off until it disappears completely. It is a mix of blood, mucus and uterine tissue. Personal hygiene should be practiced by the new moms during the bleeding just after childbirth. The sanitary napkins, tampons, menstrual cups, etc. should be used and disposed of safely. The episiotomy wound should be taken care of as advised by the doctor. Intercourse should be avoided until the perineal wound heals. Also, condoms should be used for prevention of HIVs and STDs. Hand washing several times is very important to prevent infections. Birth spacing is also very important, and for that a contraception or a family planning method should be adopted with the help of the doctor. Also, ideal good breastfeeding practices should be adopted, and the woman should take only prescribed medicines while she is breastfeed. Home environment is also very essential for proper growth and care of the baby, and also recovery of the new mother. Such as good ventilation, good hygiene, and emotional support. Now, coming to the danger signs, the mother should immediately reach the hospital or the healthcare center if she notices the following danger signs, such as increase in vaginal bleeding, increase in vaginal discharge or smelly vaginal discharge, difficulty in breathing, shortness of breath, chest pain, etc., fits, fever and inability to get out of the bed, severe headache and blurring of vision, calf pain, swelling and redness in the calf, swelling and red and painful breasts, swelling and redness at the cesarean site or the episiotomy site, suicidal tendencies, depression or persistent anxiousness just after childbirth.